again. All right, so we're looking at the anterior view of the occipital bone, that lowest part of the skull, the base of the skull, and then our cervical vertebra. So we have C1 and C2, the atlas and axis. And you can see here, anchoring on that base of the skull, we have the longest capitis. Remember, capitis meaning head. And then we have these two portions. You see 13 and 12 here. Those are both portions of the longest coli. Okay, big time flexors here. You have that forward head posture. These are the muscles that you really need to tighten up to get that chin back into proper alignment and take that stress off of the cervical spine. Then you can see here we have both of these little sets of two there. Those are the intertransversary. Remember, your transverse processes, especially in the cervical region, they have little wings. So you have those two different segments of the intertransversary. Bilaterally, they're going to extend. Unilaterally, they're going to laterally flex the cervical spine. These are only found in the cervical and lumbar regions. Now I'm going to angle this a little bit so that you can see a little bit better. All right, that's going to be the cervical region of the spinalis muscle. And then we have these here. You see how they're doubles, the 8s. Those are the interspinalis muscles. And remember, the cervical spinous processes are bifurcated. So that's why it looks like this here. And then number 9, we have multifidi. The shorter ones here, we have rotatorus. And those bilaterally are going to extend the spine or hold that cervical spine erect. And these go all the way up, all the way down the spine. And then unilaterally, they're going to rotate the spine to the opposite side. Now let's look at our suboccipitals. You can see number 3 there. Those are going to be your rectus capitis posterior minor muscles. They're going to gently rock the head back into extension. Note that they attach from the occipital bone down to the posterior tubercle of the atlas. That is a condyloid joint, and therefore those muscles are incapable of producing any type of rotation. Now number 5, you can see number 5 there and there. Those are the rectus capitis posterior major muscles. They come all the way down to the spinous processes of C2. And since they cross that pivot joint at C1 and C2, those can produce rotation. And those are going to be same side rotators. Now let's look at our oblique muscles. The number 6 up here, that is your oblique capitis superior. And that is going to be a lateral flexor as well as extensor of the head there. And then number 4, your oblique capitis inferior. Again, we're going to be crossing that pivot joint with number 4 here, the oblique capitis inferior. So we are going to be able to produce rotation to the same side, just like the rectus capitis posterior major. So number 4 and 5, think they're both going to be those same side rotators. Whereas number 6 is only coming to the transverse process of C1. Again, only crossing a condyloid joint. So that is only going to be capable of producing that small amount of lateral flexion to the same side. Now I'm going to show you 2 additional sets of muscles that we have never had on a model before. These are not on your test. Again, not on your test. But we have number 1 here. Those are going to be your rectus capitis anterior muscles. And then we have over here, I think number 2, there and there. Those are your rectus capitis lateralis muscles, just like the rectus capitis posterior muscles to the posterior of this model. However, directionally you see anterior and then lateral. And that's this model.